Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what an MRI is, what an MRI can diagnose, MRIs in epilepsy, an MRI versus an fMRI, risk of having an MRI, how to prepare for having one, and what to expect while having one. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. We appreciate your support. An MRI, also known as magnetic resonance imaging, is a medical imaging technique which uses a magnetic field and computer-generated radio waves to create detailed images of the organs and tissues in your body. MRIs allow radiologists to see cross-sectional areas of the brain, helping them to locate areas where seizure activity can be taking place. When evaluating areas of the brain, such as the frontal lobes, MRIs can provide 3D imaging and special coronal cuts to look for malformation or tissue atrophy. MRIs can help to diagnose any abnormalities, damage, blockages, and evaluate to find infections. When it comes to epilepsy, an MRI may be ordered when the following is taking place: onset of seizures at any age with evidence of focal onset in history or EEG, onset of unclassified or apparently generalized seizures in the first year of life or adulthood, evidence of a focal fixed deficit on neurological or neuropsychological examination, difficulty in obtaining control of seizures with first-line anti-epileptic drug treatment, loss of control of seizures with anti-epileptic drugs, or a change in the seizure pattern that may imply a progressive underlying lesion. MRIs can be used to help diagnose epilepsy. Doctors are looking for scar tissue, tumors, or any abnormalities that can cause someone to have a seizure. MRIs can pick up abnormalities that most CT scans cannot, such as small lesions and small tumors. Examples include hippocampal sclerosis, which is shrinking or tissue atrophy of the hippocampus, and malformations of cortical development. In the article Neuroimaging in Epilepsy, studies have shown MRI abnormalities are identified in 80% of patients with refractory focal epilepsy and 20% of patients with a single unprovoked seizure or epilepsy in remission. According to Yale Medicine, an MRI allows doctors to examine the patient's organs, tissues, and bones. A functional MRI, or fMRI, looks at the function of the brain. Functional MRIs are scheduled to determine if surgery is an option. Approximately 24 to 48 hours before surgery, an fMRI is performed, giving neurosurgeons an accurate look at the region that is being affected, helping them to prepare and plan a surgery. An fMRI is performed in the same machine as an MRI. However, the patient is given a set of goggles like virtual reality. Tasks such as squeezing a hand and thinking of certain words can help detect the activity of the brain and if surgery is a safe option. Patients with certain devices may not be able to have an MRI. It is important to let your doctor know if you have any of the following: metallic joint prosthetics, artificial heart valves, an implantable heart defibrillator, implanted drug infusion pumps, implanted nerve stimulators, a pacemaker, metal clips, metal pins, screws, plates, stents, or surgical staples, cochlear implants, a bullet, sharpener, or any other type of metal fragment, intrauterine device. There is not much to prepare for when getting ready to have an MRI. When arriving, you will change into a gown and be asked to remove anything that could affect the magnetic imaging. Examples of items are jewelry, hairpins, eyeglasses, watches, wigs, dentures, hearing aids, underwire bras, and cosmetics that contain metal particles. Some physicians will order an MRI with contrast. This is done to get a more detailed look at certain tissues and blood vessels. According to the NHS in the UK, the risks of an MRI with contrast are feeling or being sick, skin rash, headache, and dizziness. In some cases, patients who are claustrophobic or are children, infants, they may be given a sedative to make sure they relax and hold still during the procedure. The technician will be in a different room, but will be able to see you and communicate with you at all times. It is important to communicate and do as the technician instructs you to do to prevent any results from looking blurry, which can prevent the doctor from making a diagnosis. Do what you can to stay calm throughout the test. Many people choose to wear headphones and listen to music while having the procedure. Some technicians can put the radio station on for the patient, or they can bring a CD to listen to. According to Epilepsy Society, the average MRI scan to help diagnose epilepsy lasts around 30 minutes. In conclusion, an MRI is a medical imaging technique which uses a magnetic field and computer-generated radio waves to create detailed images of the organs and tissues in your body. MRIs can be used to diagnose many things, including epilepsy. While MRIs are performed to look at organs, fMRIs are performed to watch the function of the brain. There are many steps to prepare for an MRI, and patients need to understand what they can and cannot do during an MRI, or if they are at risk if they have one. When having an MRI, a technician is there with you to help you through the test, which when diagnosing epilepsy lasts on average 30 minutes. To learn more about MRIs and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos on our channel and subscribe today. You have the power to defeat epilepsy.